dominant hand with the blades closed. Insert it about 1 centimeter into the vestibule. Keep the blades vertical and stabilize yourself by placing your index finger on the tip of the nose. Shine the pen light with your non-dominant hand as you gently open the speculum blades. With the patient's head tilted back slightly, view the nasal cavity. Coarse hairs should line its anterior surface. Ciliated membrane should line its posterior surface. Throughout the nasal cavity, the mucosa should appear red and moist, and there should be no lesions, drainage, or obstructions. Also observe the nasal septum. Remember that a deviated septum is normal unless it obstructs airflow. Finally, inspect the turbinates, which are located laterally. They should be light red and free of swelling, tenderness, and polyps. Before examining the mouth, ask the patient to remove any dentures. Then begin by inspecting the lips. They should appear moist and normal in color, should close symmetrically, and should be free of lesions, cracking, and edema. Next, palpate the lips, which should feel soft and smooth. Now ask the patient to bite down and bare his teeth while you assess jaw alignment. In the front of the mouth, his upper teeth should override the lower ones slightly. Then assess the oral mucosa using a tongue blade and pen light. Normally, the mucosa is pink, smooth, and moist, and has no lesions or nodules. Remember that hyperpigmentation is common in dark-skinned patients. Also assess the teeth and gums. Normally, adults have 32 evenly shaped, ivory-colored teeth that are firmly embedded in the gums. Now inspect the rest of the oral cavity. The hard palate should appear bony and whitish. The soft palate should look muscular and pinkish. The uvula should be pink, midline, and free of lesions. The tongue's dorsal surface should be symmetrical and slightly rough with a midline groove and small fissures. The ventral surface should be smooth and pink with visible veins. Using a gauze pad, hold the tongue to one side and palpate the floor of the mouth. You should feel no lumps or indurations.
Okay, open your mouth and
Next,
stick out your tongue.
have the patient stick out his tongue. It should be midline and free from tremors.
Okay,
Then put the tongue blade to the side of the tongue and ask the patient to push it away. Tongue pressure should be equal on both sides. These actions test the hypoglossal nerve.
Good. Open your mouth.
Also check the glossopharyngeal and vagus nerves by depressing the tongue and having the patient say ah. The soft palate should rise symmetrically and the uvula should remain midline. While the patient says ah again, assess the pharynx and tonsils. Their mucosa should be smooth and pink. Then grade the tonsils' size on a scale from +1, in which the tonsils are visible, to +4, in which they touch each other.
Identify.
If the patient reported loss of his sense of taste during the health history, assess the facial and glossopharyngeal nerves by having him identify different flavors.
Cinnamon.